Dr. Liz here. I'm a psychiatric nurse practitioner with a doctorate degree, and I am coming at you with little informational tidbits about psychiatric care for your family and you. So one of the biggest questions that I get asked a lot in clinic is, how do I know if my child has ADHD? So in this video, I'm not going to talk about like the different types of ADHD or the treatment options or why it's so important to treat ADHD, because it is. Instead, I'm going to link those videos below, and in this video, we're just going to talk about the criteria to answer that question of like, how the heck do I know if my kid has ADHD or not, okay? So to start with, I just want to say that some kids are just spicy, like they are just full of life, full of energy, and there is nothing wrong with them. They are just fine, okay? But if your little one is so full of energy and or they also have trouble focusing to the point that it is causing issues at school and at least one other area of their life, such as at home or like socially with friends, okay, then we need to take a closer look at the child's behaviors. So if a child potentially has ADHD and attentive type, we're gonna see some different things. The biggest thing that we're gonna see is that inability to focus or pay attention. They're just gonna really struggle with attention to detail. When they're trying to do their schoolwork, they're gonna make silly mistakes that like doing simple math or writing their name, things that they should know how to do, silly mistakes. They're gonna be often daydreaming, like looking off into the distance, and you're like, hello, where are you? So their mind wanders quite a bit, okay? They tend to be easily overwhelmed, easily frustrated. They tend to be disorganized. It's hard for them to keep things clean and tidy and neat. And then the biggest thing I hear from parents is that they're forgetful. These poor kiddos, like you remind them over and over and over again to do basic things like take out the trash or even brush their teeth, brush their hair. And these children, they just can't. And that's a hallmark of ADHD. It's not that the child is trying to be malicious. It's not that they're trying to be defiant. They want to do what you are asking them to do. They just can't. And that can lead to some other issues. So the child starts to think, what's wrong with me? Am I dumb? Am I stupid? And that leads to low self-esteem, low self-confidence, which can then turn into depression and anxiety. So we got to be careful of that. If your child potentially has ADHD hyperactive type, they can focus just fine, but they cannot keep their little booties in their chair. They're always squirming around. They're touching things with their fingers. They're tapping their little feet. Teachers will often complain. They'll call mom and dad, email, say, hey, little Billy, little Susie can't stay in their chair. They're up, they're wandering around the classroom, they're bothering the other kids, they're interrupting learning. These kids tend to talk excessively. They tend to interrupt others or blurt out answers. And oftentimes when they interrupt or blurt out answers, like what they're saying doesn't make sense. They're off on a tangent and you're like, what the heck are you even talking about, child? Okay. So just really all over the place. They have a hard time keeping their hands to themselves. They have a hard time standing still in line or waiting their turn. And then again, just the leaving the seat. That's something that we hear a lot from the teachers. They just can't sit still for long. Sometimes it's to the point that they can't even sit still long enough to finish a meal or to like finish a cartoon or to watch TV. ADHD combined type has all of those behaviors that I just mentioned. So the child has trouble sitting still, but they also have trouble focusing. Now, something to remember with all of the ADHD types, it doesn't matter if it's inattentive, hyperactive, or combined. All of the behaviors need to be present for at least 6 months or more, and they need to be developmentally inappropriate. That means that if you bring a 2-year-old to me and you're like, hey, my 2-year-old can't sit still, they can't focus, I'm gonna look at you and I'm gonna say it's because they're 2. Like, we would not expect a 2-year-old to be able to sit still or to be able to focus. But if you bring your 6-year-old to me, then I'm gonna say, okay, that's a little weird because we do expect a 6-year-old to sit still and be able to pay attention for a certain amount of time, okay? So that's when we would look a little bit deeper. So part of our evaluation is the child and their parent comes in and we gather just like tons of information. So we bombard you with questions. It's kind of like an interrogation because we wanna make sure that we're not accidentally diagnosing the child with something that they don't have. We also want to make sure we're not missing a diagnosis if it's there. So we're going to ask all kinds of questions like, what school do you go to? What grade are you in? Do you have a 504, an IEP? Mom, dad, was he born preterm, full term? Tell me about family history. Is there anyone else in the family who has ADHD? Tell me about like medical stuff going on in the family. Give it to me. Give me all that information. We're also most likely going to give you something called a Vanderbilt screener, which is a questionnaire, and we want the parent to fill it out, and we also like the teachers to fill it out, preferably at least 3 teachers. And again, it's just gathering information, gathering data so that we can ensure that we are accurately assessing what's going on with the child. Because sometimes people come in and they're like, hey, I think my little one has ADHD. And it's not, it's anxiety or depression or something else, because a lot of things mimic ADHD. Okay. Now, I just want to reassure my parents that ADHD does not mean medication. Yes, that's one of the resources that we use to treat ADHD, and yes, it's very safe and it's very effective. But if you are not comfortable with medication, we do not have to do that. There are lots of other options for treating ADHD. If we do use medication, we always use as little medication as possible for as short of a time as possible with kids. We just really try and avoid medicating them if we can, okay? And that brings me to my next point. Even if you are like, my kid doesn't sound exactly like how you're describing, Liz, that's okay. I always tell my parents, you're the mother, you're the father, you know your child better than anyone else. So if you've got an inkling and you're like, I don't know, something just doesn't feel right, bring them in. Let a psychiatric provider assess them. Okay, there's no harm in doing an evaluation. There's no like permanent record. It's not going on no psychiatric record, nothing like that. But again, we want to make sure that we're catching something if it's there so that we can treat the child and help them to be as successful as they can possibly be. My last point, I just want to validate you because taking care of kids is really hard, okay? And the fact that you're even watching this video and trying to educate yourself, that speaks volumes about you. I do want to remind you, we're kind of like an airplane. Like when you get on an airplane and the stewardess tells you, a mask is going to drop, make sure you put your mask on before you put your child's mask on in case of an emergency. Same thing. So in psychiatry, the parent needs to be healthy. You need to be physically and mentally healthy so that you can take care of your child. Okay, so just be mindful, make sure you're looking out for you, make sure you're getting good exercise, you're staying hydrated, you're eating healthy, doing the best that you can. Again, I know it's hard when we've got kids. Okay. Otherwise, I just wanted to say thank you for watching this video. Please subscribe so that you can see all the other videos that come out. I try and drop one at least once a week. Check out the comment section for additional videos on ADHD. And otherwise, I wish you and your family well. Take care.